All right, hello everyone. Thank you so much for joining us. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health System, and welcome to our very latest community conversation here at Atlantic Health. And today, I am very excited to be joined by Dr. Walter Rosenfeld. He is the Chair of Pediatrics at Goryev Children's Hospital and the Medical Director of Children's Health for Atlantic Health System. Doctor, thank you so much for joining us today.
Thank you. It's really my pleasure to be here, and it's not just a figure of speech. I really am happy to be here and talk about the future, not just the present and the past.
And I think that's a great point, because our audience, for those of you who have sort of new to our community conversations process, over the last couple of weeks we've been having these conversations initially in the very early stages of COVID-19, and then more recently we've been having more specific conversations about the types of care people can avail themselves of. And so it has become very much a forward-looking conversation, which I think is valuable for folks. Just to give a little bit of a recap, if you're new to our community conversations format, Dr. Rosenfeld and I will have a conversation for a little while, incorporating some of the questions we've received from folks and some of the topics that people want us to touch on. This conversation not only will be streamed live on Facebook and on LinkedIn, which is a new addition to our distribution portfolio, which is exciting, but afterwards, in case you gotta log off or you gotta jump somewhere else and come back, the full thing will live on Facebook and on LinkedIn. It will also live on our website, atlantichealth.org, so you can check it out there. And then finally, if you get News 12, it lives on News 12 Plus, 8:30 to 9 on Saturday and Sunday mornings on News 12 Plus. So nice diversified way for people to see it. So again, this conversation today is about a subject that I know, Doctor, a lot of people have had interest in on our social media communities, and that of course is around pediatrics. But I think it's always valuable to start first with a little bit of a step back before we move forward. Can you talk a little bit about, for our audience, what it has been like over the last few months and weeks for pediatricians as they continue to try to keep children in New Jersey healthy, our pediatricians specifically?
Yeah, Luke, I'm really glad you asked me that. I mean, this has been just an unprecedented time for those of us in healthcare. I think it's fair to say it's been an unprecedented time for everyone.
Sure.
And I think we have to remember back when this first started, we really didn't have a clear idea of how affected children would be.
Right.
We knew from China and other parts of the world, children seemed to be less infected, but we weren't really sure what was going to happen. So we got geared up, we got ready for this. Fortunately, one of the few really positive things is the rates of infection in children and the rates of serious illness in children have been much lower than in adults.
That's true.
That's not to say that children haven't been sick. That's not to say we haven't had to provide care for those children and given them all the excellent care we have. But it's been a rough time, and I feel so privileged to work with such a talented team. Physicians, specialists, surgeons, nurses, respiratory therapists, everybody pulling together to give the best possible care. And in fact, some of our care was to help our adult colleagues that were just swimming in cases, lots and lots of cases. The story with children, though, is moving on, and I'm glad we are where we are right now.
I know for our team, I'm sure you've had an opportunity to chat with them throughout this process. And certainly pediatrics is a field where I'm sure the physicians who practice it and are involved in it are very passionate about the children.
Yes, they are.
In their care. And that this process has been just as scary for them, I'm sure, in some ways, as it has been for their parents, wanting to make sure you do right by all of your patients.
Yeah. I don't want to overemphasize how difficult it's been for the healthcare team. It has been. It's been very stressful. But I really feel for the parents and the patients. There are so many frightening parts of this to them, especially at the beginning when we didn't know as much as we know now, and there's still a lot of unanswered questions. And I am just so respectful and in awe of our community and how parents have tolerated this and the children have. We treat patients up through age 21, so we have a lot of older teenagers.
Yeah, most people probably think pediatrics is in 5 to 7 to 10 year range.
Yes, and the younger patients, of course, are very frightened. The older patients have a different set of issues that we all need to deal with. Sure. And I think what I've seen evolve is how not just the healthcare team, but how the patients and parents have gotten more used to things, including things like visiting rules. Like at the beginning,
Right.
that was very drastic, and now the
For
parents,
the safety of everyone.
for the safety
Right.
of everyone, so that the patient and the staff and the patient next door are all protected. And now the parents ask us about those things because they understand that they need to be protected.
The idea of deferred care, and that's something that we've talked a little bit about previously in some of our other Facebook Lives with other physicians as it relates to adults, is an important thing. But there is an awful lot of care that children receive very early in their lives that is really important to their well-being as they grow. And the Commissioner of Health, Judy Percy-Kelly, talked about, just as an example, immunizations. The rate of immunizations have plummeted over the recent weeks and months. Can you talk a little bit about deferred care as it relates to children and how important it is that we begin to catch up on that and quickly for a lot of these kids?
Yeah, this is an issue that gives me great concern, and I think I'm really glad you asked about that. There's the whole issue of well child care for newborns, infants, children, adolescents, young adults. There's so much that goes into that pediatricians really specialize in, and family medicine doctors as well. Mm-hmm. And given this gap that we've had because of everyone's justified concerns about transmission of COVID, a lot of that care has been postponed. We need to catch up. There are serious illnesses that are totally preventable. So, people are afraid to go out. They're afraid to go. We have our doctor's offices now set up to be safe. Most doctor's offices have separate ill child care time and then well child care. There's all kinds of things, sanitizing, use of masks, all kinds of things that are happening. We have got to get back on track. And immunizations for diseases that can be deadly, such as measles, meningitis, even cancer. We have a vaccine for cancer. Those things must get back on track. And in fact, people are talking about their fears. Immunizations is the antidote to fears because this will prevent disease. Those diseases are not going away.
What about just even something as remedial as a checkup? I mean, are there
Absolutely.
things that are identified in those examinations that are really important to the safety and well-being of children?
Sure. For young children, there's so much education that goes on with parents. There's the discovery of developmental disorders or learning problems or other types of issues, hearing problems, visual problems that take place in pediatricians' offices. For older school-age children, other things start to happen. For adolescents, there's a pretty high background of depression and anxiety, substance use, use of vaping, which we know has really become a big issue,
concern.
a big problem. Those are things that happen in the pediatrician's office, and they need to continue to happen.
All right, so what then is the best course of action? If you've had patients who have said to themselves, all right, look, my son or daughter really probably should have had this examination back in March or maybe even February if they really have delayed it for a while, but I've heard this message, it's time to get going. What would be their first course of action that you would recommend?
Yeah. So first of all, I don't think people should be panicked that they've delayed these things. You can catch up.
Okay.
But now is the time to start doing that. Call your pediatrician. For parents of children with chronic illness, really important to stay in touch with your specialist, your pediatric pulmonologist or pediatric gastroenterologist or one of a number of specialists. But the primary care pediatricians and family medicine doctors, they should be your first line. Get back in touch with them. Ask them questions. If you're afraid about something, ask them. I know in our community, pediatricians have done a wonderful job of setting up their offices to make it safe for patients, safe for their staff. Ask those questions. Ask, what have you done? I'm a little bit afraid to come in. What have you done to make me feel reassured that when I bring my child in, we will both be safe?
And you touched on it a little bit about specialty care, emergency care, the value of those services for children as well. And I don't want to lose sight of the gamut of things that children and parents may need to avail themselves of, because there are a number of children out there who are living every day with very serious health considerations. Can you talk a little bit about the strata, if you will, of those types of services and what you would recommend for parents to keep in mind as they begin to set up basically a care regimen for their kids moving forward, getting back to this type of care for their kids?
So let's just start with one specific example, asthma. Asthma is the most common chronic illness in children. And we have, at Goriab Children's Hospital, we have a fabulous pediatric pulmonary group, but there are groups all around the state. You should be going to your doctor for that care.
And summertime, I would imagine, is where asthma can really become
Yes,
a
it can
concern.
be year-round. Summertime can be one of the times for children. We've set up our pulmonary function labs with our respiratory therapists so they are safe, so that they have special ventilation and they're perfectly safe for children. But there are children with inflammatory bowel disease, Crohn's disease, ulcerative colitis, children with kidney disease, heart disease, high blood pressure. We have eating disorders. We have, there's a wide range of problems. You need to be in touch with your doctor. And that's the chronic disease. So the other part of it is acute things happen. One of the really unfortunate things that we've seen is patients have come in late in their course with acute appendicitis and had a much more complicated treatment because of that, because they came in late. This is the time. Stop. Please try to not be so afraid. At least call and get advice. I think most doctors will give you the right advice.
There is an element of disease that we are learning about seemingly more every day and week, and it is what some folks are tying to COVID, and that, of course, is what's known as the multi-system inflammatory syndrome in kids. And I think our goal with this series and with this conversation specifically is to provide relevant, actionable information for folks to separate fact from fiction to the best of our ability to do so. And this particular situation seems like an area where there's some education that needs to happen out there. And so to the best of our ability, can you give our viewers a sense of what do we know right now about this particular syndrome and how it's impacting children?
Yeah, great question. Let's start with perspective, though. The Commissioner of Health in New Jersey gave out statistics that there are, in the 30s, about 35 patients in the state that have been reported to have this illness. That's out of 2 million children in New Jersey. So it is rare, okay? But, of course, if you're a parent, you're going to be concerned. Pediatricians are concerned if your child has it. So the things to look for that will make you think your child could have it, and to go the next step, and the next step would be to ask the right questions. The things that you should look for are fever that's persistent. So a temperature of more than 100.4 that lasts more than a day, usually accompanied by one or several of many, many other features, such as difficulty breathing, abdominal pains, stomach ache, a rash, and sometimes being lethargic, tired, or sometimes being very irritable. And those are the types of things to look for. If your child has those things, they don't have to have them all. If they have just 2 of them, you should call your pediatrician and say, this is what I'm seeing. What do you think? I have heard so many examples of where parents are really worrying themselves sick. They call their pediatrician, and the pediatrician says, no, your child has X. It is not this new entity, MISC, multi-system inflammatory syndrome. But there have been children where we've had to have an evaluation. They can have blood tests. There are some treatments that are necessary. Really important, if your child has this, to get them to a hospital where we can provide the right kind of treatment.
And I know that for folks out there who are wondering about the intricacies of this, how it's contracted, all of that type of stuff, I know that the state and the health commissioner have tried to share as much information as they can on their statewide resources. So there are some official channels you can go to, both at the state level. CDC has some information on their page about it as well. So there is, we're still learning a lot about this, but it sounds like we're learning more and more each day that'll inform us and how we can care for patients and the guidance we can give to patients as well.
Let me say one more thing about that. Remember, this syndrome was not described until early May.
That's right.
This is so new. And
it's less than a month.
It's less than a month.
Yeah.
And there are cases now from around the world, but few, and yet it is very frightening. So we need to be vigilant. Our doctors are prepared to treat it. We are set up, we know how to treat it, we know what to do.
No children have, by the way, according to the commissioner, no children have
That's
died
right.
as a result of this condition yet.
No
So
children have died as a result of this condition. So we want to get those kids in as quickly as possible if they have it. And your role as a parent, if you think your child has it, is to call your doctor. Get the right advice from your doctor. If you can't get in touch or there's some other problem, call or go to your emergency room and get the right care there.
I want to pivot to something that is maybe a little less visible in terms of the symptoms, but no less important. You and I had a conversation the other day where we talked about the mental health of children. And look, I think everybody can be forgiven for feeling the anxiety over the last few months and not quite feeling like themselves over the last few months from an emotional standpoint. I was hoping you might be able to talk for a little bit about what you would want parents to keep an eye out for, to think about as we have this conversation about mental health in our communities. And do children get affected the same way as adults do? What's been your experience in this area?
Okay, that's such a great question. Of course, children are affected, but it depends on their age and their level of maturity. And also, we all have a pre-COVID life.
Right.
So some people are more anxious than others. Some people already have the diagnosis of depression or anxiety. You layer on to that this whole business, which everyone is worried about. Of course they are.
Sure.
And it can be devastating. So the rule with very young children is to be a good observer. Try and talk to your child. Talk to them about what's going on and what their fears are. Children are very intuitive at any age, and they often pick up on things. Parents talking, you think your child may not hear you, just your body language and how you say things. Children pick up on that. As you get to older children, you can have more open discussions about what they're feeling and give them information. I think it's helpful to start with questions about what they're feeling. Answer their questions as honestly as you can, but not with too much information, especially with younger children.
Right.
Answer what's really being asked. Don't have to go further than that because you may not know what their worries are. Try and find out about that. What I would look for are signs of withdrawal, a child or an adolescent who previously was playing and interacting and verbal and now is much quieter. Sometimes hyperactivity could be a sign of anxiety or depression. And certainly if your child is telling you that they're feeling sad or depressed, or if you have a child of any age that says they're thinking of harming themselves, take that seriously. That's something that always should be taken seriously, and get help. Go to either call your pediatrician, come to the emergency room, but be sure to get help.
To your first point, the idea of questions, is it about giving them the space, children, I mean, giving children the space and the latitude to ask those questions and then engaging with responses? Or is it about proactively asking children questions? How are you feeling? How are you doing? Or is it both?
Yeah, I think it's both. That's a very good way to put it. I think it's both. I think you want to be a little intuitive and anticipate and give some information about that. If you and your partner or your spouse are talking about something that you realize your child has been listening and it's a little scary, go back. Do a little bit of translation, but also do a little bit of asking them what they've heard. What are they feeling? Are they afraid? And I think, it needs to be a little bit of a combination of factors. Again, I've probably said this 4 times already. Ask your doctor. If you're not sure about what's going on, ask your pediatrician. If you're already hooked up with somebody, a therapist, psychologist, ask them. Don't be afraid to do that. That can be so valuable to parents in helping to guide them with their child.
I want to pivot. We've got about 7 to 8 minutes, give or take, left, and I want to save some time for this last portion because I think it's something that everybody's talking about right now. So at my house, I have 2 little ones at home, and generally speaking, it's impossible to separate them from their friends and at school and all of that, and that obviously has been put on hold for so many of us. And so as they look to the summer, and we're anticipating a summer of activity and camp and all of those things, we're forced, like every other family, to re-examine our plans and how that's all going to work. I am sure you've had people ask you what you think about that and any guidance you may have shared. So I'm wondering if you could take a moment to talk a little bit about whether it's summer camp or whether it's play dates with friends or whether it's going to grandma and grandpa's house, whatever it may be. What's some of the, in the general, some of the guidance you're providing to your patients and to parents and to share with the other pediatricians we've had here about the summer ahead?
Yeah,
What are you looking at?
Yeah, so look, the reality is there have been so many disappointments. People have had to cancel plans, and summer camp for children is often something that they look forward to, going to the pool, interacting with friends, bicycling, all these things. Yes, of course, it's been disappointing. But when I said at the beginning, I'm glad to be here because I want to talk about the future, this is what I'm talking about. And there are many more opportunities. The weather is nicer. Being outdoors is one of the safest places as long as you're socially distancing, and if you are getting closer, wearing a mask. Of course, as a pediatrician, I have to remind people children younger than 2 probably shouldn't be wearing masks. But if you're getting outside, it's great. It's probably a much lower risk for contagion if you're outside and you're socially distanced. So I know a lot of people that are looking for those opportunities. With young children, it's hard to explain to them, but I wouldn't underestimate how much you can do with younger children in trying to keep them socially distanced. I know there are some summer camps that are still planning to conduct their camp. If I were a parent, what I would advise, and as a pediatrician, what I would advise, ask the camp, what are their plans?
Talk to them.
Talk to the camp. What are they doing to protect your child? What are they going to do if a child gets sick while they're at summer camp? What's their plan? If you're getting vague answers and they don't know, I would be really hesitant to send my child to any camp in that circumstance. But they may have a good plan. It may be very reasonable. So I think what would be great is let's get kids outdoors. They still need to remain socially distanced. Let's not forget about other things like sun protection. You know, we're so worried about... We have a whole universe
of things we could be having conversations about.
Sun protection is a lifelong issue that starts in childhood. Need to make sure that happens. Going into a pool, if you have a pool in your backyard or a neighbor's pool, the risk is not the water. It's probably not the water at all. The risk is forgetting and getting too close and getting that transmission. So whatever you're thinking about doing with your child, look at that. Now, I was looking online. There's a lot of great resources. The Smithsonian has some things. Scholastic Magazine has things. Go online, look for creative things to do, both inside and outside with your child. Hiking. Hiking doesn't need to be rock climbing. It can be taking a walk and socially distancing.
Luckily for me, it can just be taking a walk. That's
and you know, I want to add one thing. One of the silver linings of this really terrible problem we've been in with this epidemic is I've seen so many families have better time together, more time talking with your children, spending time with people in your household. That can be a good thing, but we also need to get out because you need a break. You need to mix it up a little bit.
I want to touch on one thing you mentioned too early on that I think for some folks it could stand some reinforcing. If so, the idea of very young children, 1 to 2 years old, and this idea of mask wearing. I think, you know, it's an effective, obvious, from a prophylactic standpoint for adults, but obviously, and I'm assuming the point you're making is that breathing, just respiration and the fear of suffocation can be a very real thing. So social distance then is the order of the day for those kids? What would you recommend?
For the younger children that can't wear a mask, the mask itself could be dangerous to them. Social distancing is the most important thing. And remember, when you talk softly, you don't have as much aerosolized material that comes out. When you talk loud or you're excited or you're playing a game, there's much more. So you really need to maintain that social distancing. You know, I mentioned resources. The CDC is a great place to look for guidance about this. New Jersey Department of Health has a lot of good information on their website. Atlantic Health System has a lot of good information out there. And I think it's really helpful for parents to rely on those sources. Remember, I sometimes hear people saying, we don't know. There's nothing, we don't know anything. That is not true. We know a lot, but there are many unanswered questions. It's evolving. Stay in touch. Talk with your pediatrician. Go to these reliable websites, not other websites that you can't really trust.
Sure. From an activity standpoint outside, and this will be common whether you're at a camp or whether you're at a socially distanced birthday party or however you want to do it, the idea of hand washing and hand sanitization for children. I would think whether it's playing catch or throwing a football, I've had people say, well, I see everybody at the park, all these kids who may or may not live in the same household are throwing the same ball to each other, their hands, how important is that concept?
Yeah, thank you so much. I can't remember that I've used that term hand washing during this interview, and that is so
It's like
important.
a giant checklist.
Yeah, right, thank you for bringing that up. Hand washing, hand washing, hand washing. So yes, if you're having a catch, you're throwing a football, you're going to have that contact. And I think, you need to look at recommendations. Remember, the governor has come out with certain recommendations, making things a little bit more liberalized over time, where you can do more.
Yeah, we're seeing more reopenings.
More reopenings, but hand washing, use of hand sanitizers is going to be very important in those circumstances because you are having contact with others. The other thing that needs to be said, in addition to hand washing, if someone is sick, they should be isolated. And they may have a regular cold, but they're going to be coughing and sneezing, and if they should have co-infection with COVID, they're much more contagious. So anyone who is sick should be isolated. And that goes for healthcare workers, people in their offices at work. This is not the time to tough it out and go to work or be with other people when you're sick.
We got time for one last one, and then we'll let you go. But as we look way down the line to the fall, schools, I'm assuming the same considerations that exist at camp will inevitably exist at schools too. Is there a thought process or a perspective that you would recommend these administrators have when they decide how they're going to build their plans for next fall?
Yeah.
Is it similar to the camps in terms of having those levels of planning?
Yeah, similar and different. I mean, camps are elective. They're great. They're a great outlet for many, many children, but learning is not elective.
Right.
That is such an important part of childhood. And so the school systems are working feverishly to figure out how they can best educate children and keep them safe. And I know some schools, including some colleges, are looking at opening, and some are going to do it virtually. So we're going to have to see how that evolves. But I know people are looking very intensely at how to keep it safe and keep the learning ongoing.
Excellent. Dr. Rosenfeld, thank you so much for having this conversation with us. I know it's a topic of great concern for not just our viewer, for everybody really who has kids. And I know that we'll be learning more and more over the months to come, so I hope you'll come back and join us again maybe a little further along, and we can give everybody an update on some of the stuff we've
Thanks for having me, Luke. This was a real pleasure.
Excellent.
Thank you.
All right, folks. Thank you so much for tuning in. I know there's some technical considerations that we've got early on in the program, but the entire program for everybody who wants to watch will live both on atlantichealth.org, where you can go to the community conversations section and see all of this one and all of our previous shows. You can find it on our Facebook page. You can find it on News 12 Plus over the weekends on Saturdays and Sundays. You can find it on LinkedIn. Basically, where all your great Atlantic Health System programming exists, you'll be able to find our community conversations. We thank you so much for joining us. We have many more to come. We'll be looking at oncology soon as well, and in addition to a number of other topics. So again, thank you, Dr. Rosenfeld.
Thank you.
All right, folks, we'll see you next time.